instead of slaying the Affordable Care Act, we look to enhance it, fix it. I have never said, as one of the authors of it and the Senate Finance Committee, that it's a perfect piece of legislation. The overarching scope of the legislation is challenging. And there were some unintended consequences. There are some things that could be done better. But every time we have attempted to improve the legislation or deal with the unintended consequences, our colleagues want to slay it. So it's like you open up the patient in an operation and then your goal is not to heal it, it's to kill it. And so we've had not the ability to do that. It would be my hope that if they come to a point in which they understand that they cannot reconcile their differences, that then we can have a foundation for changes that deal with policy, that deals with premium issues, that creates greater number of insurance companies by creating market stabilization policies. Under the Affordable Care Act right now, interestingly, the president talks about letting insurance companies sell across state lines. Well, under the Affordable Care Act, you can do that. There's specific provisions that you can do that, but insurance companies have not chosen to do it because of their own concerns about their bottom line. So the reality is there's a series of things that we can do. We want to continue to work with hospitals and other providers to pay not on a particular procedure, but to have better outcomes. So that and many hospitals are working on this. I know Betsy and her association is how do we end up seeing less readmissions into hospitals? That's less costly for the system, that saves money. So there are many ways in which we can improve upon the law, but hopefully their roadblocks become permanent barriers and then they come to a conclusion that it's time to join us in an effort to improve upon that which we've built so far.